Hi, I'm Sue Foyle, Director of Nursing and Midwifery, and welcome to Rockhampton Hospital Maternity Unit. If you're expecting a baby, congratulations! Rockhampton Hospital cares for around 1,400 women giving birth each year. We have an amazing team who are here to support you through this very special time of your lives, whether you have a normal pregnancy or have more complex needs. Our goal is to provide the best standards of care and support to ensure that you and your family are safe and have a fulfilling birth experience to take you forward on your journey through to parenthood.
Hi, I'm Midwife Judy. It's important that you know that early and regular antenatal care is an essential part of getting the best outcomes for both mum and baby. So as soon as you think you're pregnant or you're planning to become pregnant, please see your GP so they can help you get into the best health condition for pregnancy. You have a number of options for your pregnancy care. They include shared care between your GP and the hospital, midwifery group practice, private care by an obstetrician or private midwife. There's total hospital care for higher risk women, and the Gummagundu service providing culturally sensitive care, particularly for Aboriginal and Torres Strait Islander families. Your GP will conduct a number of routine investigations at the beginning of your pregnancy, which might include blood tests and ultrasound, and your doctor will then send a referral to the hospital where you're choosing to birth. If you're planning to birth at Rockhampton Hospital, you'll be contacted by us with a booking visit appointment when your referral is received. At this booking visit, you'll spend about 2 hours with a midwife who'll take a thorough health history and discuss your pregnancy care plan. You'll receive a pregnancy health record at this visit, which you should take with you every time you attend a healthcare appointment, and remind your caregivers to update your record each time they see you. A popular model of care is provided by our midwifery group practice, where your primary caregiver is a known midwife. This midwife will care for you throughout your pregnancy, your birth and postnatal period. One of the advantages of this program is that you'll become very familiar with your midwife, and you can have most of your antenatal visits in the community rather than coming to the hospital. Once you're past 20 weeks in your pregnancy, you can come directly to the maternity unit if you have any pregnancy-related concerns or complications. We like you to ring us first so that we can be prepared for your arrival. This phone call also allows us to advise if you need to come very quickly or if the matter could be dealt with by your GP. Please remember to bring your pregnancy health record when you come. We encourage first-time expectant mums and their support people to attend antenatal classes, which are held on Thursday evenings at the hospital. It's a 4-week program held every month. Ideally, you'll be about 30 weeks pregnant when you attend. If you've never been to the Rockhampton Hospital before, we encourage you to ring and arrange for a tour of the maternity unit and birth suite, so that you can feel more familiar with the environment when you do come to have your baby. When you're planning to pack your bag for hospital, remember to bring everything you need for your baby, including nappies and clothes and bunny rugs, as well as everything that you need for yourself. Always ring the birth suite on 49 206 471 before coming to the hospital for any reason, and bring your pregnancy health record. If you're an out-of-town mum coming to Rockhampton, accommodation for your support people needs to be pre-arranged. Subsidy for the costs of your travel and accommodation is available by contacting the Patient Travel Office at your nearest public hospital. There are no facilities for support people to stay in the maternity unit. There is some accommodation at the Red Cross rooms across the road from the hospital, and you can contact them on 49 273 080 for current pricing. Please note that meals are not provided by the Red Cross House, and the closest shopping centre is approximately 20-minute walk down Canning Street. If you have a low-risk pregnancy and you're in early labour, we encourage you to stay at home for as long as possible. This allows you to keep things normal in your home environment. Once your labour establishes and you feel the need to come to the hospital, your support people can be with you for an unlimited time while you're in birth suite. Please advise them to wear comfortable clothes and shoes and to bring some snacks and drinks. They can access the cafe from 6 a.m. to 6 p.m. each day. You are encouraged to bring your own music and comfort items for labour. Hopefully you've considered these things when you complete your birth plan in your pregnancy health record. One of our birth suites has a water immersion bath for labour. Please let us know when you ring if you'd like to use the bath so that we can allocate this room to you if it's available. If you're having a planned caesarean section, you'll be advised by the hospital day surgery unit when and where to come for admission. You can also have your support person with you in the operating theatre if you're having a spinal anaesthetic and you remain awake during the procedure. Your support person can bring a camera or a phone to take photos of your newborn baby. Your support person can also stay with you in the recovery room while you are providing skin-to-skin contact with your newborn. Most mums will go home on their third day after a caesarean section if mum and baby are both well. Postnatally, we aim to get all mothers and babies home from hospital as quickly as possible, as soon as you are both well enough. Midwives provide most of your postnatal care, and in addition we provide the services of a lactation consultant, physiotherapist, social worker or Indigenous liaison officer if you need their support. Visiting hours in our maternity unit are from 8 a.m. to 8 p.m. with a rest period between 1 and 3 p.m. where just one support person can remain with you. Our mums tell us that they need this break during the day to rest and spend private time with their newborn. It's very important that midwives have enough time with you to help you feed and care for your baby when you're in hospital. So please talk to your visitors about allowing enough free time for this to occur. This is particularly important on the day you're going home, as we have a lot of information to share with you. We also encourage you to talk with your friends and family about sending flowers to home rather than to the hospital, so that you can have more time to enjoy them. Rockhampton Hospital provides planned births of 32 weeks gestation or more, so babies born more prematurely than that require transfer to a tertiary centre such as in Brisbane. We do have a special care nursery for premature and unwell babies, so if your baby requires admission to this unit, you may stay longer in the hospital as a boarder mum if your baby is likely to go home within a couple of days. If baby requires a much longer stay, it'll be necessary for you to arrange accommodation close by if you don't live in Rockhampton. For the safety of our newborn babies, visitors to our maternity unit, particularly to our special care nursery, must be free of any infections or conditions and follow strict hygiene requirements. Once you go home from hospital, you'll receive postnatal visits. If you're in the Rockhampton region, the Child and Family Health Nurse will offer home visits to you to check on you and your baby. If you live outside the Rockhampton area, a postnatal referral will be arranged with your local services. It's important then that your personal details such as your address and telephone number are always updated if you make any changes. This allows us to provide the appropriate follow-up care to you. If you have any questions about your pregnancy journey, please contact us. You can also get more information about our service on the website link below.